For this case, we have a 20-year-old female who has had a below-the-knee amputation. She also has a history of osteoarthritis of bilateral wrist. She also has numbness at the end of her residual limb as well as phantom limb sensation. So for the first part of the lab, I'm going to go into doing the residual limb assessment, and the first thing I'm going to do is test sensation. So with sensation, you basically want to explain to the patient what you're doing, and then also I would test the dermatomes as well as both sides just to kind of do a comparison. So the first thing that I'm going to do is test light touch and deep touch. So explaining to the patient, I'm going to pick an area where the patient can actually feel. Can you feel that?
Yes.
Okay. So for the light touch, this is what you're going to feel. And then for deep touch, it's kind of more of a pressure sensation. So I'm going to test that on your feet. But what I have to have you do is close your eyes, and then I want you to let me know whether you feel that light touch or deep touch. And I want you to say light if you feel light touch and deep if you feel deep touch. Okay, go ahead and close your eyes.
Light. Light. Deep. Deep. Light. Deep. Light. Deep.
Okay. So that is the light and deep touch. The next thing I'm going to test is hot and cold. And basically with that, I would take two different tubes and fill one maybe with hot water and one with cold water. So I am going to use these metal tweezers for cold touch, and then just kind of use my skin for hot touch. All right, so going back to testing an area that the patient is able to differentiate. That's cold, that's hot. Okay. All right, go ahead and close your eyes. I want you to let me know if you feel cold or hot.
Hot. Cold. Cold. Hot. Cold. Hot. Hot.
Okay. So that's the hot and cold sensation, and then next we're going to test proprioception. Now with proprioception, basically going to see if the patient is able to tell me which direction his toe is moving in. So if I bring your toe up, I want you to say up. If I bring it down, I want you to say down. Okay, go ahead and close your eyes.
Down. Up. Up. Down.
Okay, good. All right, then the next one is kinesthetic sensation. With this one, basically you're moving the joint, but I'm also gonna have you use your opposite foot to move your joint in the same direction that you feel me moving it in, okay? So if I go up, then yeah, you move your foot up, and then if I go down, you move it down. If I bring it in, and out, okay? All right, ready? Go ahead and close your eyes. Good. Okay, and open. All right. Next one is vibration. Now that one you would basically use a tuning fork and kind of pick like a bony area. So I'm gonna pick like the medial malleoli, and what you would do is you would press the tuning fork, and then there would be a vibration sensation. So when you feel that vibration, I want you to let me know if you feel it by saying yes, or if you don't feel anything, say no. Okay?
Yes. Yes.
Okay. And then the last sensation that we're going to test is the 2-point discrimination. I'm going to use some tweezers here. It has 2 points. So I'm going to go back to the area where the patient is able to feel the sensation. If you feel 1 point, it's going to feel like that. And it's 2 points, it will feel like that. So when I have you close your eyes, I want you to say whether you feel 1 point or 2 points. Ready? Close your eyes.
One.
Good.
I can't tell. 2.
Good.
1.
Good.
2.
Good. All right. Now we're going to use a monofilament, which is a 5.07 monofilament wire. And I'm going to test the sensation on the patient's, on his bottom surface of his foot. And this basically will let me know whether the patient has lost the protective sensation or not. So I'm going to go back to the area that you're able to feel. When I press, it's kind of going to feel like a little light prick sensation, okay? So if you feel the sensation, I want you to say yes if you feel it, okay? We want to make sure when you press, kind of get that little bend in the wire.
Yes. 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 Yes.
Okay, good. All right, so that completes the sensation assessment. I'm now going to go to measuring for edema. And with that, you want to kind of start distal and then work your way up until you come to an area where edema is no longer present. So if I start at the feet and I press in, if there was edema, there would be an indentation in the patient's foot. And if that indentation is barely detectable, that would be a 1+. But if I press and the indentation lasts for 15 seconds, that would be considered a 2+. And if I press again, and then you have an indentation that doesn't rebound, that does rebound within 30 seconds, then that would be a 3+. And then if you press and then you have an indentation that rebounds, takes longer than 30 seconds, then that will be considered a 4+. If you don't have any indentions, that will actually be considered non-pitting, which would be a score of a 0. And then also, when you're measuring edema for a below the knee amputation, I'm gonna come right under the kneecap. And then circumference-wise, you would want to measure how much swelling is in that area. And then going down another 5 centimeters, you would measure again around that area and record that measurement. and you go all the way down every 5 centimeters. And to actually measure the length of the residual limb, starting under the knee again, and then you would measure to the end of the stump. And I would also measure that other side just to kind of get a comparison. Okay, now we'll do the pulse. So for the lower extremity, you can have the femoral, you can palpate the femoral artery, which is right in that femoral triangle. You can also do the popliteal pulse, which is behind the knee. You can also do the posterior tibial pulse, which is right behind the medial malleoli. And then the dorsal pedis pulse, which is between the big and second toe. And for a 20-year-old, it is considered normal if her pulse is between 60 and 100. The average is about 80 beats per minute. Now we have the residual limb assessment out of the way. We'll go ahead and perform one of the tests, one of the functional tests. So I'll have the patient put his shoes back on. And then we'll go over to this chair here. And I'll just have you sit in the chair. So what we have here is I have measured out exactly 10 feet. And I'll put a piece of tape where our 10-piece mark is. So with this test, what you do is when I say go, you stand up from the chair, walk to the tape, turn around, and come back to sit down. And I'm going to time you to see how long it takes you to do that. Okay? Let me pull up my timer. All right. So when I say go, you will walk to the line. If you can stand up from the chair without using your hands, that would be better. And then you'll walk to the line, come back to sit down. All right. Ready and go. Very good. So that was 8 seconds. And that is considered good with that test, that you have a decreased risk of having a fall. Okay, now we're going to, I'm going to demonstrate how you would actually route the below the knee residual limb. Get these out of the way. Okay, I'll have you sit there. And for the purpose of this video, I used the bowling pin, and I kind of wrapped it because when I use the ace route, it slides off of the material. So this material kind of helps hold the ace wrap in. All right, so my knee joint is going to be up here, and this is the end of my stump. This is actually the lateral aspect of the stump. This is the medial aspect. So when you first start wrapping, you want to start laterally, and kind of at an angle. And then we're going to come up. and around. And then we're gonna use the figure 8 pattern. And then if you notice, I have my window for my knee there. I wanna make sure there's no wrinkles in the ace wrap. And then we're gonna kind of continue using that figure 8 pattern. And distally, it should be a little bit more tighter than proximal. So I'm gonna take this piece of tape. Once I have that first piece of ace wrap on, I'm gonna tape it there. And then the next piece, we're actually gonna start medial, which is the opposite direction. And then again, go under. Hang on. And then I'm gonna come back up, wrap around. And then just kind of continue in that 8 figure. And then as we get kind of closer towards the end of the wrap, that's when you want to cover that window where the knee would be at. And then we'll add our last piece of tape on. Okay.